Let me set the scene. Your patient has just arrived in PACU after a long abdominal surgery. They're groggy. You hear snoring, and the pulse oximeter shows a slow drop in oxygen saturation. What do you do, and how fast do you need to act? In this video, we're diving into airway management, one of the most time-sensitive and critical parts of your role. This content is designed to sharpen your clinical instincts and support safe, effective nursing care. My name is Kevin, and I'll be your learning facilitator. So how do nurses recognize who's at risk? Common airway vulnerabilities or patients at high risk for airway compromise include those with obstructive sleep apnea, OSA, obesity, recent facial or neck surgery, residual sedation, or neuromuscular blockade. Assessment tools and signs include Mallampati classification, snoring, stridor, or paradoxical chest movement, oxygen saturation under 92% despite oxygen, need for airway adjuncts or manual repositioning. Airway assessment is continuous, before, during, and after procedures. Now, let's take a closer look at what to do and airway interventions by recovery phase. In phase 1, PACU, elevate the head of the bed, insert oral or nasal airway as needed, apply humidified oxygen, suction secretions, support with bag valve mask BVM if breathing is ineffective, prepare for possible reintubation. In phase 2, you must monitor for delayed obstruction, encourage deep breathing and coughing, educate patients, especially those with OSA, on resuming CPAP. Nurses play an important role in the health and safety of patients. It is critically important that you know when to escalate and be able to identify red flags. Call for help immediately if you observe persistent hypoxia despite intervention, increasing work of breathing or apnea, audible stridor or suspected obstruction. Let's put it all together. A patient with known OSA begins snoring and shows shallow chest rise. You elevate the bed, insert an oral airway, and apply BVM support. SpO2 returns to 97% and spontaneous breathing improves. This is what clinical success looks like. Timely assessment, prompt intervention, and improvement. Great job. Let's recap. Nurses must recognize key risk factors, perform ongoing airway assessments, match interventions to recovery phase, escalate care when needed. Before your next shift, take a moment to check airway equipment, suction, and oxygen tools in your unit. Readiness can make all the difference. In our next video, we'll cover thermoregulation and injury prevention, a vital aspect of protecting post-op patients. Thank you for watching.